and welcome to the third recording of the Pain Management Program Handbook. We're going to start off this recording, just like the last one, by getting you to reflect on what you learned in the last recording. So have a think about what you learned, the things that you found out, and now also what you're going to do, what you're going to take away. Okay. If you need to pause the recording to give yourself more time, that's perfectly okay. We're going to start off this recording with some strengthening exercises. Just like the exercises in the last recording, please bear in mind that you should only do the exercises that you feel comfortable or happy to do. These exercises aren't right for everybody, but they are a good range of exercises that some people can use. If you feel that you are moving into something that is not right for you, then please stop and speak to a healthcare professional who might be able to advise you a bit further. So here are some examples of exercises that can strengthen the body. To strengthen your body, you need to work your muscles. Muscles can ache after they're worked. The less fit you are, the longer the ache takes to come on and to go away. Some people may ache up to 3 days after doing exercise. This is normal. Light movement and walking can help reduce the ache. You can gradually increase the amount of strengthening exercises that you do. Remember to do this slowly as shown in the graded exercise session. So start off in a laying position. So flattening your lower back to the floor and then arching it away. You can do this a couple of times and then find the midpoint between the two positions. You want to try and keep this position throughout the following exercises. Once you are comfortable, tighten your lower abdominal muscles, drawing your belly button in towards your spine. This does not need to be a hard, forceful contraction, but should be instead a gentle one, so that you can still breathe normally. If you feel that you start to lose this, just try and reset it as best as you can. Start off by practicing doing this for a few seconds at a time and building up. Pause the recording here if you want to take time to practice this. The next few exercises start off in this position. Laid on your back with your knees bent up and your back in a comfortable position as close to halfway between arched and flattened as you can. Now lift one leg so that your hip and knee are bent to 90 degrees. Try to do this without either flattening or arching your back, leaving the other leg in place on the floor. Hold for a breath and then lower your leg back to where it started, and then repeat on the opposite side. You could do this 5 or 6 times. You could even build it up beyond that if you feel capable. This next exercise is a little trickier, and only try it if you feel happy to. Instead of lifting one leg up off the floor, you're going to lift both. As you breathe in, bring your legs up off the floor, bending your hips up to 90 degrees, but not going past this point. You can hang your feet down, but lifting them off the floor, and lower them again with the breath out. Take some time if this is something you want to practice or have a go with. rolling onto your side but keeping your body in roughly the same position with your knees bent, your feet together, your knees together, and your back a degree of straightness. Line up the back of your head, your shoulder blades, and buttocks, and soles of feet, again as if you were laid on your back, but you were laid on your side. Keeping the inner borders of your feet together, slowly lift your upper knee as far as you can without your pelvis rolling backwards. You may wish to put your arm on the floor to hold yourself steady, and then bring your knee back down again. You can do this a few times, 5, 6, or more, and then try on the opposite side. The next few exercises are done in standing, maybe with something in front of you to support you or to help you keep your balance. Again, please only do these exercises if you feel that they are right for you. We're going to do a mini squat. So standing behind a stable chair, support yourself with both hands. Slowly bending your hips and knees, keeping your back straight. Your knees should not go past your toes as you slowly dip down. And then bring yourself back upright. You shouldn't need to go too far, and only go as far as you feel comfortable to do so. It's not about doing a deep squat. Even a small version of the movement can be very good for your thigh muscles. The next exercise is hip extension. Standing, holding onto a chair, bring one leg backwards. Keep your legs straight and try not to arch your back too much, bringing it back to a standing position and repeating on the other side. Again, you can do this a few times, you can do it 4 or 5 times, you can do it as many times as you feel happy to do. The next few exercises can be done in sitting or standing. Bring your shoulder blades back and down, widening at your collarbone. Hold for a breath or two, and then relax. Again, you might do this a number of times. And finally, to work some of the smaller muscles in the neck, bring your chin in towards your neck. Avoid tipping your head forwards. Draw your chin backwards as if to create a double chin, the sort of thing you don't want to do in a photo. You'll feel a lengthening in the back of your neck. Return to the start position after a breath. You might repeat this a few times. Next, we're going to look at common mood changes. Depression is very common, and looking around as you walk down the street, there are at least 1 in 10 people there experiencing depression. However, you might not be able to tell by looking at them. Psychological symptoms of depression include feelings of hopelessness and helplessness, low self-esteem, tearfulness, feelings of guilt, feeling irritable and intolerant of others, lack of motivation and less interest and difficulty in making decisions, lack of enjoyment, suicidal thoughts or thoughts of harming someone else, feeling anxious or worried, a reduced sex drive. Depression can also have physical symptoms which include slurred movement or speech, change in appetite or weight, usually decreased but sometimes increased. Constipation can be an issue, as can unexplainable aches and pains, lack of energy or lack of interest in sex, changes in the menstrual cycle for ladies. We can also see disturbed sleep patterns, for example, problems getting off to sleep or waking in the early hours of the morning. If you're depressed, it may affect the way you interact with others, including not performing well at work, taking part in fewer social activities, and avoiding contact. You might also feel isolated, reduced hobbies and interests, and difficulties in home and family life. Anxiety can range from feeling uneasy or nervous to having a continuing feeling of dread. It is a normal response, and everybody feels anxious from time to time. Anxiety becomes unhelpful when there seems to be no good reason for it, or if there is a lot of anxiety. People with chronic pain often feel anxious. You may find yourself worried about many things, such as the pain and its intensity, the cause of the pain, about body symptoms such as lack of sleep, about movements and actions that increase pain, about getting back to work, about what people think about you, about what might happen if you become disabled. Anxiety can be useful to help you perform at your best and deal with danger, but higher levels can interfere with your life and happen when there is no danger. Psychological effects of anxiety. When we are anxious, our body releases a hormone called adrenaline into our bloodstream. Below are a few examples of what adrenaline can cause. Our heartbeat can increase so that more oxygen can be supplied to the muscles. Our rate of breathing can increase so that we have more oxygen to prepare us for action, i.e. for flight or fight. Sweating occurs because the body requires an efficient cooling system. Our senses such as hearing and sight sharpen and become more sensitive. As a result, any slight change is exaggerated. Our blood is diverted away from our digestive system to our muscles, so we may experience butterflies in our stomach. We may overbreathe, hyperventilate, which can lead to feelings of dizziness and tingling in our fingers. Breathing difficulties can also be an issue when actually we are getting too much oxygen. This hyperventilation can in itself make the other symptoms worse. Anger and frustration is another psychological observation of chronic pain, are common in people who suffer, and particularly in those who suffer from chronic pain. Life may begin to feel like a constant battle to avoid pain, and you may become angry or upset if you feel that people do not understand or are not listening to you. Anger and frustration can make you feel irritable. It can make you be restless and uptight. It can make it harder to concentrate. It can cause flashes of anger or rage. You may think you're being treated unfairly. People are deliberately upsetting you. Maybe you feel that pain is ruining your life, or that everyone else is in a better position than you. Physiological effects of anger and frustration include heart racing, a tight feeling in your chest, sweating, needing to go to the toilet, blood rushing to your head, feeling sick and stomach churning, muscles tensing. These feelings can lead to changes in behaviour, and you may shout, throw objects, cry or become tearful, storm out of a room that you're in, hurt yourself or other people, be less tolerant of people around you, or maybe bottle up your feelings inside. The power of thoughts. People have thousands and thousands of thoughts every day. Our thoughts are usually generated automatically. Some are neutral thoughts, such as, I need to switch the lights off when I go out. These thoughts do not create negative feelings or alter sensations in the body. However, some thoughts are highly charged and may spring into our minds without us realizing it. Thoughts such as, no one likes me at work, or how am I going to pay my bills? This kind of thinking can cause us to react in a negative way and create suffering. We call these negative, powerful thought stories. Take some time to think about and write down, if you wish, your thought stories about yourself or your situation. You can pause the recording here if you need to. We often take our stories to be true and allow this to influence how we live our lives. This program uses a variety of techniques to help us distance ourselves from these thoughts. For example, think about one of the stories you have identified. For example, you might have said that you're a failure, and then try the following exercise. Put the following phrase in front of your thought. I am having the thought that, for instance, I am having the thought that I'm a failure. What has started to happen? Then put the phrase, I am noticing I am having the thought that. So in the example we're using, I am noticing I'm having the thought that I'm a failure. This should help you to get some distance from your story. Another technique that some people find helpful is putting their thoughts to a familiar tune when they come to mind. Try this walking and noticing exercise at home. Imagine you are sitting on a river bank and leaves are dropping off the trees and falling into the water. As you sit there, you watch the leaves as they pass you. As you become aware of your thoughts, you can choose the thoughts which you need to respond to, thoughts which require action in the present moment, thoughts that you can respond to. You can allow the thoughts which are random, distracted, or highly charged to just float by. Distancing does not try to stop you having the thoughts, it just helps you to get some distance from them, so you can see them for what they are, which is just stories, not fact. Mindfulness or awareness takes practice. We can learn to be aware of what our bodies are feeling, how we hold ourselves, how we move. We sometimes become so focused on our pain that we become unaware of other pleasant sensations in the body. Thoughts and feelings exercise. How do you feel when you see a dog? What goes on in your head? What goes on in your body? What would you do if you met a dog in the park? In the handbook there is a picture of a German shepherd dog, a very fluffy one that looks like Lassie from the old television show. The experiences that you've had with dogs in the past will affect your answer to this question. For some people, experience has taught them that dogs are friendly creatures who love to play. They might have feelings of warmth and happiness or excitement, and an urge to stroke the dog or to throw a ball for it. Other people may have had negative experiences of dogs in the past. They might think that dogs are unpredictable wild animals who sometimes bite people. Meeting this dog might lead to feelings of anxiety or fear, a racing heart, feeling breathless and sweaty. This person would probably want to avoid getting close to the dog at all costs and may change their route to avoid going to the park altogether to minimize the chance of meeting dogs. The way we think can affect the feelings we have, the things that we do, and the way that our bodies react. It is important to recognize the thoughts and feelings that you might have about your pain. These will certainly be having an effect on you. There is a very strong evidence that understanding your pain using a CBT model is one of the best ways to help people manage their pain and get their quality of life back. There's a diagram here with physical sensations in the middle, and then thoughts, feelings, and behavior all joined together in a circle surrounding it, indicating that our thoughts affect our feelings, which affect our behavior, which also affect our thoughts again, and all of this can have a physical impact on us. Try this exercise, my pain cycle. Imagine you're having a bad day. What kind of things go through your head? How do you feel emotionally? What kind of things do you do? What effects might these things have on you physically? Try and write down how you would categorize these things into thoughts, behaviors, feelings, and physical. So to remind you of the questions, what kind of thoughts are going through your head? How do you feel emotionally? What kinds of things do you do when you're having a bad day? What effect might all of this have on you physically when you're having a bad day? Record it in whichever way you feel is right for you. Maybe pause the recording if you need some time. So here's an example of Sarah's pain cycle. So her thoughts are, here we go again. What did I do to trigger it off this time? If I'm like this now, how will I be when I'm older? I hate this so much. This is so unfair. Her feelings are sad, frustrated, angry, scared, and miserable. Her behaviour is to go back to bed, to comfort eat, to try not to move, to snap at her kids, or if it's a work day, she'll take loads of medication and pretend the pain's not there. On a physical note, this has an impact of her putting on weight. She knows that she's getting weaker by not exercising. She's tired all the time. She's run down. She's always catching bugs. And this diagram shows all of these things being connected. On the next page, there is a visual illusion called the black dot exercise. It is a black dot in the center of a piece of white paper with a grey halo around it. The exercise asks you to stare at the black dot, and the common observation is that the grey circle around it starts to shrink, become invisible. The moral of this exercise is that sometimes when we focus on our pain, we lose sight of everything else around us. Noticing, evaluating, and distancing from unhelpful thoughts. Sometimes when you are caught up in an unhelpful thought, it is difficult to realize it is a thought at all. It feels like it is real and it is the truth. Remember, if you were in a very different mood, the thought might not even be there, or it might not seem so true. See the list here to see if they help see your thoughts more clearly. So I'm going to list common unhelpful thoughts. Feeling overwhelmed, or that you can't cope. Self-pity and asking, why me? All or nothing thinking. So an example of this is, if I can't do it the way I used to do, I'm a failure. Another common unhelpful thought is being stuck in the past. So an example might be, why can't it be like it used to be? Maybe people feel that there is a worst possible outcome. For instance, I'll end up in a wheelchair. Another common unhelpful thought is being unable to move forward. I've tried before, it will not work, is an example. Another common unhelpful thought is blaming yourself. I ought to be able to do it. You can also blame others, an example being the doctor should be able to fix me. Another unhelpful thought is mistrust of others. They're only saying it, they don't mean it, would be an example.
I feel depressed, then it is true that things are hopeless. Here's some questions.
Am I blaming myself for something that is not entirely my fault?
Am I catastrophizing or jumping to the
Am I
worst
blaming
case
someone
scenario?
else and not taking
Am I
responsibility
thinking in black
myself?
or white terms?
Am I
with
mind
no
reading?
shades of grey?
Assuming that I know
Am I
what
focusing
others
on my
think about
weaknesses
me?
and forgetting my
Am I
strengths?
expecting myself or someone else to be perfect?
Am I taking something personally?
Exaggerating? Am I assuming that I can do nothing to help myself? Notice your thoughts. How do they make you feel? Do they seem helpful? Are they encouraging you to live a better life? If there is a better, more accurate thought, is there a better thought that will help you to make positive changes? Remember, you may need to do some relaxation, some gentle movement, or mindfulness practice to help you get a better perspective on your thoughts. Next, in the handbook, there is a challenging thoughts table. It asks you to fill out some sections to help you with your thoughts. I'll read you the questions. Please feel free to pause the recording to work through them. The first question is, what situation started the unhelpful thought? What situation started the unhelpful thought? The next question is, what are or were the thoughts? What are or were the thoughts? The next question it asks is, how do they make you feel? How do they make you feel? The next question is, how would you rather feel? How would you rather feel? The next question is there a thought that is true and could make you feel this way? Is there a thought that is true that could make you feel the way you would rather feel? And finally, how does it feel trying this thought on for size? How does it feel trying this thought on for size? Now we move on to posture, a different topic. We move our bodies through many positions, depending on what we are doing. How our bodies move depends on our body's structure and shape. Our posture might also be affected by how we are feeling emotionally, how we have learned to do things, or how our body feels. We also use our body to communicate with others. Sports fans whose team is winning often look different to the losing side. Pain can have an impact on how we move. It is natural if you have pain to move differently and seek more comfortable positions. In injuries, this can be part of the process of healing, protecting injured areas. In long-term pain, posture changes can be due to reduced fitness, strength, and altered habits. Because pain often makes moving more difficult, and it can affect our posture, it has been long suggested that bad postures can be the cause of pain. It makes sense because we all get uncomfortable in certain positions, and this can even be a bigger problem in those with persisting pain. A lot of people with long-term pain will question if their posture is part of the problem. It is also a link made by doctors, nurses, physiotherapists, osteopaths, chiropractors, and massage therapists. Often good and bad posture is taught as part of treatment or even as part of moving and handling training in work. What is really confusing though is that we all know people whose posture is bad, that have no big problems with pain. I'm sure you can think of someone in your life who looks a bit like the pictures below, who never gets more than the occasional ache. If posture is a big cause of persistent pain, we could expect studies to pick up on this. However, a big review of the research has not found a very strong link between what we might think of as bad posture and the development of persisting pain in the back. Further, worrying about posture has not been found to make much difference in dealing with pain. Collections of studies about back and neck health have found that on average, working on posture does not make a big difference to people's pain. As a result, advisors to the NHS have not made recommendations on treatments aiming to correct posture. This might be because there is more research that needs to be done. It might also mean that something that we once thought was very important may not be such a big problem. This does not mean that you have been told about posture in a wrong way. It might just not be as important as previously thought. It is still a good idea to think about how you use your body. Spending long periods in a small number of positions can make us feel uncomfortable. It may lead us to not using some joints or muscles as much. For instance, being in a slouch posture makes it hard to use your shoulder fully when reaching up. This might be a reason to consider moving more regularly and, if able, trying to change your posture regularly. If this is a problem for you, think about how you could change this by setting alarms or something that happens regularly to prompt you to get up, move, or go do something different. Some positions will always be painful and hard for some people. Sometimes, though, slowly easing into a posture or practicing it regularly may make you move more confident and may make your movements easier to do, even if it is painful. For instance, a keen crown green bowler might find their bowling action harder to do after a knee injury. Practice can help them return to their bowling position and get back into something that they enjoy. Sometimes we must be creative about doing things in different postures, different to what we used to do anyway. For instance, you can sit when ironing clothes, or change your garden to stand and use raised beds. This can be hard to come to terms with at times, but it may help you to return to activity that is important to you. We're finally going to finish with a mindfulness exercise, this one titled Mindfulness of Breathing in Sitting. Settling. Settle into a comfortable sitting position, either on a straight back chair or on a soft surface on the floor, with your bottom supported by cushions, or on a low stool or meditation bench. If you use a chair, sit away from the back of the chair so that your spine is self-supporting. If you sit on the floor, it is helpful if your knees can actually touch the floor, although that may not be happening at the beginning. Experiment with the height of the cushions or stool until you feel comfortable and firmly supported. Allow your back to adopt an erect, dignified and comfortable posture. If sitting on a chair, have the feet flat on the floor with legs uncrossed. Gently close your eyes if this feels comfortable. If not, let your gaze fall focused onto the floor 4 or 5 feet in front of you. Bringing awareness to the body. Bring your awareness to the level of physical sensations by focusing your attention on the sensations of touch, contact, and pressure in your body, where it makes contact with the floor and with whatever you're sitting on. Spend a minute or two exploring these sensations. Focusing on the sensations of breathing. Now bring your awareness to the changing patterns of physical sensations in the belly as the breath moves in and out of the body, just as you did lying down. Focus your awareness on the mild sensations of stretching as the abdominal wall gently expands with each in-breath, and on the sensations of gentle release as the abdominal wall deflates with each out-breath. As best as you can, stay in touch with the changing physical sensations in your abdomen for the full duration of the in-breath and the full duration of the out-breath. Perhaps noticing the slight pauses between an in-breath and the following out-breath, and between an out-breath and the following in-breath. As an alternative, if you prefer, focus on places in the body where you find the sensations of the breath most vivid and distinct, such as the nostrils. There is no need to control your breathing in any way. Simply let your body breathe by itself. As best as you can, also bring this attitude of allowing to the rest of your experience. There is nothing that needs to be fixed, no particular state to be achieved. As best as you can, simply surrender to your experience. Working with the mind when it wanders. Sooner or later, usually sooner, your mind will wander away from the focus on the breathing sensations in the belly, getting caught up in thoughts, planning or daydreams, or just aimlessly drifting about. Whatever comes up, whatever the mind is pulled to or absorbed by is perfectly okay. This wandering and getting absorbed in things is simply what minds do. It is not a mistake or a failure. When you notice that your awareness is no longer focused on the breath, you might want to actually congratulate yourself because you've already come back enough to know it. You are, once more, aware of your experience. You might like to briefly acknowledge where the mind has been, noting what is on our mind, and perhaps making a light mental note. Thinking, planning, or worrying might be labels you give it. Then gently escort attention back to the breath sensations in the belly as you bring awareness to the feeling this in-breath or this out-breath. Shiver is here as you return. However often you notice that your mind has wandered, and this will quite likely happen over and over again, each time take note of where your mind has been, then gently escort your attention back to the breath, and simply resume attending to the changing pattern of physical sensations that come with each in-breath and with each out-breath. As best as you can, bring a quality of kindness to your awareness, perhaps seeing the repeated wanderings of the mind as opportunities to cultivate greater patience and acceptance within yourself and some compassion towards experience. Continue with the practice for 10 minutes, or longer if you wish, perhaps reminding yourself from time to time that the intention is simply to be aware of your experience, moment by moment, as best as you can, using the breath as an anchor to gently reconnect with the here and now each time. That way you notice where your mind has wandered off and is no longer in touch with the abdomen. You return to being in touch with this very breath in this very moment. Thank you for your time again. This will be the end of the third recording. We'll start again with the fourth recording of the Pain Management Handbook. Goodbye.